and community updates. So let's take a look at the latest. It is on everybody's mind. What is going to be happening when the kids go back to school? And I have the perfect guest to talk on this subject. You know him, you love him. It's Dr. Harrington. Dr. Harrington, how are you?
Hi, I'm fine, thanks. How are you doing, Eric? Good to see you.
I've been better, but I am doing
Right.
great. I had a little bit of a spill on my mountain bike, broke my elbow, and got a concussion. But other than that, I am amazing.
Oh, that strap's not just part of the decoration? Oh, okay.
It's not part of the. This isn't a costume for the job.
Mm. Well, get well
So,
soon.
Dr. Harrington, it's on all the headlines all across America, but specific to Routt County, kids are going to be going back to school real soon. What does that look like for our kids?
Well, it definitely looks like something different. We've not done school during this COVID pandemic. Most schools shut down in March and April, pretty early in this process, so we don't have a lot of experience with this. We are going into this fall creating new pathways. The school folks, private and public, have been working diligently over the summer to think through many scenarios. And now, here in the last weeks, we've been getting some more specific guidelines, both from the state and federal level. So some of this is evidence-based, some of it's based on best practice thoughts, and then a lot of it's just local entities walking through things and trying to discover where they're going to have problems. So when I say that things are going to look different, one of the key concepts is this cohorting. You can just think of it like if you have a class of 100 people and somebody has an infection in it, COVID or influenza or otherwise, all 100 people have been exposed and you have to act accordingly. If you have a class group of, say, 20 or 15, then you're only talking about another 14 or 19 people who are affected by that infection. Meanwhile, the other 80 people who potentially may have been in that class are not affected and continue on. So this cohort concept is going to be embraced and is being incorporated by all the schools. Relative to that is this idea of where are we in the pandemic? Do we have no disease? Do we have a lot of disease? Do we have something in between? And those different levels dictate the type of schooling that's going to occur. We can have everybody in person all the time. We can have complete remote learning for all people, or we pick something in between. And so we're in this in-between world. In our community currently in Routt County, we have a moderate level of disease transmission as spelled out by guidelines by the state. But we've been stable. We consistently have had 7 to 8 new cases a week on average. We clearly have not gone down since mid-June, but we haven't necessarily risen either. And that's partly reassuring that we haven't had the peak. So based on that disease transmission level in our community, that's dictated decisions by the schools. None of them are doing full in-person all the time. And they are incorporating these kind of mitigation efforts to reduce that risk and to see if we can successfully and safely continue school for the sake of the kids, for the sake of the teachers and staff, and for the sake of our community.
So it's kind of like compartmentalization then. So like if somebody in pod A gets infected, everybody in pod A isolates, but B, C, and D are still going to maintain in class.
Exactly. That's the hope. And to that endeavor, they are going to minimize interaction between groups. When people pass each other, different eating times. That's why some of the schools are doing a staggered schedule so that they don't have everybody there at the same time. Every one of these measures can reduce the risk of exposing everybody with just 1 or 2 cases.
I like that. So that was going to be one of my follow-up questions was, what do we do if one person gets it? So we're going to close down pod A, let's call it that. So how many pods, like if there's 5 pods in a school, I'm calling them pods, for lack of better words, if there's 5 pods and 2 of them get it, do we maintain the other 3, or do we say, you know what, 2 out of the 5, let's go all online? Or
well, the state has spelled out what they call outbreak criteria. And in general, we're going to deal with this just like any other place. So there's a rough concept or a guideline that we use in general that says if you have 2 cases in a facility or an activity from one event, that could be an outbreak. And so, for example, if we get 2 people in a classroom, that's an outbreak in that classroom. And there's some definitions for if we declare that there's an outbreak in the school in general. But the way this is set up is it allows for us to continue schooling with the majority or many of the other students while quarantining or isolating just a focused group that's involved. It's very contingent on that close contact concept and this pod concept or cohorts, and trying to minimize how extensive the contact is between people.
So 1 person, 2 people get infected. They close down. Is it like a 2-week period? Is that spelled out in the guidelines as far as like, okay, we close down this cohort. How long is that closed down until they can resume class normally?
No, you're exactly right. So that's the concept we use currently just in our community. And it's this isolation concept and the quarantine concept. Those same timeframes will apply in the school setting. If you are a positive case for COVID-19, you need to be in isolation for 10 days. And that can be from the onset of symptoms, or if you're asymptomatic, from the onset, from the date of the test. But that's a 10-day period because of the belief and evidence that supports this belief that most people are done shedding virus to a significant extent by the 10-day mark, and therefore their risk to others is minimal at that point. Meanwhile, you have the quarantine concept where if somebody has been exposed, we know that it takes up to 14 days to manifest that infection with symptoms. So this will be the same regime that we use in the schools. If there's a positive case, they'll be in isolation for 10 days. Meanwhile, the other students in that class and their teacher, they are likely to be in quarantine for 14 days, just as we would in the general community.
So after 14 days of quarantine, they then get a nose swab and then wait the 24, 48 hours or whatever until they get the results. And then if all of them test negative, that's when they can go resume class as normal?
Not quite. This will be, again, just like the general community. We do not test out of quarantine. And it'll be the same way with school. If a classroom has had a case and the kids have been in quarantine for 14 days and they haven't had an infection or symptoms of it, they're back in class and the test is not required.
Gotcha. Okay. Thank you for answering these tough questions. And I know it's on everybody's minds, and there's no comfortable way to think through this whole thing. And I can't even imagine being on the team of people who are thinking through how to do this. So I applaud your efforts and everybody's efforts in coming up with a design to get everybody back in school, because really education is so important, and kids really do need to go back to school and get educated, but safely. So I appreciate you.
Yeah, I think people acknowledge that there are health costs to not having our kids in school, and we're seeing more and more documentation of it. We worry about the getting behind in education. Clearly, the online education is not as effective for many of our students. So that's recognized. We want to get kids back in school. On the other hand, we also recognize the risk to the students, the risk to teachers and staff, and the risk to our community when school begins. School is often the main reservoir of illness in a community, just the nature of things with kids and all. And when we get into school starting, it's when the cold and flu season always begins. We know that children can get COVID-19. That's clear. I mean, I just was reading about a church camp somewhere up in South Dakota where they had 40, 50 some people turn positive. Many of them were under age 10. We've seen that with that Georgia camp outbreak. We've had 2.9% of the positive tests in Colorado be in children under age 10 years of age. However, we've had no hospitalizations in that age range. Well, certainly not here. In fact, we've had no positive cases locally of children under age 10. In fact, the lowest age is 16, I believe, 15. And we've had no outbreaks or cases associated with daycare. So, you know, there's positive indicators and also concerning indicators. And that's why we've got to be vigilant as we go forward, and why the schools are being deliberate in their plans to try to mitigate that risk. If we get lucky and it turns out the kids do pretty well through all this, great. In fact, that's what we'd like to get at the other end of it and go, wow, that was a lot of work for not finding much, but that's exactly what you want.
I couldn't agree more. I think we're all going into this, crossing our fingers and hoping for the best and preparing for the worst.
And we're also trying to be evidence-based in this. There's a lot of guesswork, I admit, and I think experience is making our guesswork more reasoned. But some numbers that we will be paying attention to, and these are standards that I think are being adopted around the country, is we look at the test positivity rate. And so that's a ratio for a given date or a given period of time of the number of positive tests over the number of tests that were performed in that period. In our community, so the benchmark that I think most consistently is applied is a 5% mark. If you have a higher than 5% test positivity rate, then you need to be changing something. We've never been above that in our community. Through this pandemic, we locally have been surveying all the facilities that gather tests and doing our own positivity rates. And that's typically run in the 2% range, 2 to 3% range. And last night before meetings today, I was looking at some of the latest data from the state. And I calculated over the past 2 weeks that our positivity rate was 1.78. Now, there were a couple positive cases not included. We might be missing a couple new cases, so maybe it's 1.2. But the point is, we've remained below that 5% mark. So that's a reassuring mark. Our case rate for our county has stayed relatively okay. I refer to the Harvard Institute of Global Health and their tables. Anybody that's over a rolling average of 10 cases per day per 100,000 is at risk and needs to be changing stuff. We haven't hit that mark. So our numbers are reassuring, although not where we desire them to be. And that's what we're going to watch. And we're going to try to use those to somewhat dictate when we decide we have to make changes.
Yeah, and I think I worded it wrong. I don't think it's prepare for the worst, but be prepared to fend off the worst. And that's by creating those pods, or the word that you used. Well, Dr. Harrington, thank you so much for taking your time out of your busy schedule to chat with us today. I know the viewers at home love these updates from us, so thank you so much.
Yep, I'm hoping everybody can enjoy the last parts of summer, and we can all be positive about getting into the school year. I appreciate the work that our community continues to do to take care of each other and to prevent the spread of this disease.